Good morning, friends. Good morning. We are speaking out of the UAE in Ras Al Khaimah. And amazingly, thanks to technology, both our speakers are from India. We have two outstanding speakers, Dr. Sai Praveen Harnath and Coach Lalit Adhikari. I will tell you more about Coach Adhikari in due course. But first, it is an honor and a privilege to introduce Dr. Sai Praveen Harnath. Our topic is post-COVID respiratory disorders and its management. And our lead speaker is Dr. Sai Praveen Harnath. Many things to say about Dr. Sai Praveen. I noticed from his academic certification that he's an MD in internal medicine. He's done his master's in public health, and he has an FACCP. I would imagine that is critical care and chest physician. Dr. Harnath spent 15 years of his life in the United States and then decided that he wanted to come back to India. And the critical care and chest physician, then in my book, and from reading his profile, turned into charity and compassion. So he is a medical professional who has returned to India to do work that will benefit the poor of this country with charity and compassion. And he does this through being a pioneer in many ways, a pioneer in technology, remote access. He's the lead physician of Apollo e-Access and has pioneered this concept across the country in many ways. He associates his research with the Apollo Research and Innovation Foundation. He is a TEDx speaker. And so we certainly have hopes that today will be an excellent session from him. And from a preventive perspective and amongst many other things, he was invited to associate with Johns Hopkins for smoking cessation and the negative impact that smoking would have on the chest and the lung. So here we have our lead speaker this morning speaking on post-COVID respiratory disorders and its management, Dr. Sai Praveen from Apollo Hospitals, Hyderabad. A pleasure and honor to have you, sir.
Thank you, Professor Kennedy. Thank you, Dr. Wilku, and to the RIK hospital system. And it's a pleasure to be here. Your morning, my afternoon. So we'll try to keep it brief and quick. We have only about 20 minutes to run through the whole gamut of post-COVID disease. Just a quick audio video check. Am I audible and visible? Pretty okay?
Yes, completely audible and very visible, sir.
Thank you. So I'll try to be fast. I'm sure you've all heard that the average attention span of human beings has dropped from 12 seconds to 8 seconds, less than a goldfish. So most of us are, we need to get information packaged and sent to us in rapid bursts. So I'll speak a little fast, and if there's any questions at the end, we can take those. We'll go through some big picture views on what else has to be done, and in terms of what exactly COVID does. And you can please go ahead with the slides, please. So the slides are just a distraction for you and for me, but you can just kind of listen to me. And I would request that I do this all the time. I'm distracted by my WhatsApp and my multiple phone calls, etc. But if you listen to me for the next 15 minutes, this might change your life. Maybe. I'm just kidding. But if you can just listen to me, that'd be great. So what we're going to do today is to kind of go over what the lungs do, a little bit of overview. I understand most people on the audience are people who have gone through COVID or taking care of post-COVID patients, some physicians, health providers, nurses, etc. And several people from the lay public might be watching. And at the end of the next 15, 20 minutes, you will have a better understanding of what the lungs do and what COVID does to the lungs and what can you do to overcome whatever damage that may have occurred. So once you have COVID, as you know, it's a virus. We can go to the next slide, please. So the infection that COVID causes, it kind of affects the lung directly. And as you can see here, Dr. Adrian Kennedy and his team have put together an exceptionally good overview in the webinar series they've been doing. And today is on respiratory disorders. And it's very important because most of us have to breathe and most of us don't have access to great clean air. And we're already at a disadvantage because of the lack of access to clean air. And when that is compounded by secondary things like people do, which tobacco use, hookah, etc., and on top of that, you get an infection like COVID, you have a significant problem. That's a quick snapshot of my hospital in Hyderabad. And we are obviously fairly overwhelmed in terms of the number of people who we are taking care of. Our systems are stretched, and I could not refuse Dr. Kennedy for this opportunity because I think he and his team are doing an exceptionally good job in your part of the country. Next slide, please. So if you look at COVID, the virus itself is a tiny, tiny, tiny thing. It's, nanoscale. And that background is an image from last year. And today is day 510 since the start of last year, January 1. And I've been having to kind of change that slide every so often because I was hoping the pandemic would have ended, but it hasn't. And the tiny, tiny things you see are the viral particles. And it's kind of scary to think about it, but it's also a miracle of modern science that we know so much about this illness in 500 days. We have treatments, we have vaccines, we know how to prevent it, how to treat it. It is not perfect, but at least you know what to manage and how to manage most of these situations. Next slide, please. So if you look at the human lung itself, so one of the questions is, why are the lungs important? Well, the lungs help you breathe. And if you look at the structure of the lung, you have the windpipe, and then it splits into two, and then it splits about 23 more times, and it ends up in tiny air sacs like little grapes that you see over there. And the surface area of the entire human lung is about the size of a tennis court if you actually stretch it out. And it's pretty big, 75 square meters. If you get lung infection, though, the size does go down, and depending on what game you like to play, it may be the size of a table tennis table. And what's sad, though, is that when you have this kind of a change in lung capacity, unlike some other organs, the lungs don't completely build back up. The lungs don't completely strengthen back up. The liver might do it a little bit. In fact, the brain, they're saying, may even do that sometimes. But the lung itself, unfortunately, has no great data suggesting that lost lung capacity is going to come back. The good thing, though, is that most of us are actually not using our full lung capacity. Take yourself, for example, right now. You're sitting down in a chair, most of you, and even myself, I'm kind of slouched a bit. I'm using probably 20% of my lung capacity. What if I sat up straight? That right away pushes my lung capacity up by another 20, 30%. And what if I took a really deep breath? I doubled my lung capacity. So when you take a deep breath and you're opening your lungs up, you're actually allowing the lungs to expand and use their full capacity. So we have a lot of reserve capacity. And I'm sure most of you have climbed stairs. Not all, I know there's a lot of high-rise buildings in your country, but I'm sure some of you take the stairs sometimes. And when you climb up the stairs, you'll realize the top of the stairs is a little bit short of breath. And that sensation of shortness of breath is called dyspnea, the technical term. But the shortness of breath is the kind of feeling people get when they have lung disease. And it's like you're at the top of the stairs and you've not stopped climbing the stairs. That breathing difficulty doesn't go away. And how can we fix this? It's not just COVID. You can get it from COPD, asthma, people with low hemoglobin, heart problems, people with weakness. All of these people can have difficulty in breathing because of that problem. Now, the muscles of the chest, as well as the diaphragm, which is like where you separate the chest and the abdominal cavity, all of them are important heart muscles which help the lungs to function. Next slide, please. So if you were to kind of assume that your lungs are stretched out, they're doing their job, but the American Lung Association has a slogan which says, when you can't breathe, nothing else matters. And that is unfortunately the truth. And the question about why the lungs are important is shown in the next slide, where you're actually getting oxygen. When you take a deep breath in, you're taking a deep breath and you get the oxygen. You blow out the carbon dioxide. You get protection against bugs which try to get in because the nose and the mouth have filters which help that. And of course, in your country, I'm sure you have multiple dust storms and have to cover yourself to prevent that from getting into your lungs and causing problems. So the lungs are important for basic functions of existence and human survival. And what we need to though realize is that when you're actually taking breath in, you're inhaling air, and air is actually only 21% oxygen. So if you were to take somebody on top of Mount Everest or at the bottom of the Dead Sea, the oxygen content is going to be different because of where you're located. And as you take a deep breath and the oxygen goes in people who have breathing difficulty, so we talked about the lung being the size of a tennis court. You don't have enough surface area if you have lung disease like COVID. You don't have enough space to do this exchange of gases. What happens then is the body adapts and starts pushing the heart rate up to pump blood more often. You start breathing fast to get the air in and out faster. You start using extra muscles to kind of work and open the lung up. So these are the things that will happen when you have a lung disease of any sort, especially COVID. And when you have this, you end up with a situation where you can't do this on your own after a while. You need oxygen to be supplied from outside. You might need a machine to push air in, which is a ventilator. And you end up with situations where you have to be made unconscious and kept in an ICU because this kind of breathing is not sustainable when you're awake. It's very uncomfortable. So the lungs are, as you see, are extremely important. And in COVID, you get problems because of that. Next slide, please. So this is a fact that many people don't know, but the lungs don't depend on your body weight. Fat people don't have bigger lungs, unfortunately. Tall people have bigger lungs. Women have smaller lungs than men. And a quick formula to remember is a 50 kg person, the ideal body weight is for 5 feet is a 50 kg. For women, it's 45.5 kg. And this is an important number to remember because even doctors forget that the lungs need to be expanded when you're on a ventilator or on a non-invasive ventilator, only to the extent that is required. You should not overexpand the lungs because they're like balloons, they'll pop. You may also realize that the lungs are living structures. Just like when you get a hurt on the hand and it swells up and you get inflammation, the lungs have the same thing happen. When you have air going too fast or too much quantity, it can expand the lung, but also damage the lining of the lung, trigger inflammation, and that leads to the condition called ARDS, for acute respiratory distress syndrome, which is what happens in COVID. Lucky for us, but the body has a lot of ways to fix these things, and it tries to heal it, but it doesn't do it perfectly all the time. Next slide, please. So when you actually look at somebody with lung issues, you're ending up with mind problems and body problems. With COVID, you get a lack of endurance after the lung damage. You have low oxygen delivery. You might have pre-existing problems like diabetes or heart disease, which manifest when you have COVID. You also have the unfortunate situation where you might have scarring of the lung. You might have a secondary infection because remember we talked about the lungs protecting against infection, but if you have a tube sticking down through your throat, going into your abdomen, into your chest cavity, you're bypassing that defense mechanism, and infection can go right in. Of course, they have filters, etc., but there are some bacteria which make it through, and they can be resistant bacteria. You can also have inflammation, and in COVID, we're also seeing many people with blood clots. So these are all the list of problems which people with COVID have after they're healed. The next slide, please. So if you look at the anatomy of the lung, which you talked about, they're like bunches of grapes. So this is extremely simplified. Clearly, it's my handwriting and my drawing. You can see that. But I think you get the idea, where the air sac is generally empty, full of air. However, if you get inflammation, fluid accumulates inside it. That fluid leaks out of the air sac, goes around the spaces in between the lung. And what does the lung do? It says there is something going on. I need to fix this. And it starts healing it. But unfortunately, the healing is through scarring. So just as you get a cut on the hand and you get a scar on the hand, there is scarring that happens inside the lung. Scar does not transmit gases, unfortunately. When you scar, you don't allow oxygen to come in, you don't allow carbon dioxide to go out. So people with scarred lungs end up with low oxygen, high carbon dioxide. Even 20 minutes before this webinar started, I was talking to a patient's family who is stuck on a ventilator because of this very simple but complex problem of no oxygen going in, no carbon dioxide going out because the lungs are scarred. And that is the problem with people with severe COVID. To some extent, most people have a little bit of scarring. Many people make it out with a little bit of scarring. And in several months, most people get completely healed and the lungs get back to normal, which is a good thing. They do need the support of steroids. They may need extra oxygen. They may need drugs which might cut the fibrosis and the scarring. But in general, most people are actually doing okay despite the damage. But there is a select number of people who actually need assistance and actually need help to prevent the scarring from getting worse. Next slide, please. So there's an interesting concept that's come through, and I'm talking a little bit of science here so you can understand some of the things you hear in the news. But there's a picture you may or may not have seen, but essentially you've heard of prone ventilation. What is prone ventilation? You lie on your belly and kind of take a breath. And the reason that's important is people have done studies, have done CT scans on people who are having lung involvement from COVID with ARDS or even ARDS from any condition. In fact, ARDS is a well-known entity for over 50 years. And that can happen from infections, can happen from sepsis, can happen from people who have issues with trauma, blood transfusions, inflammation of the pancreas, etc. But if you see the slides up there, you see that the white stuff is lung that is filled with fluid. And as they made the patient stay on his belly, the bottom slides are the ones where the patient is laying in his stomach. You can see the backbone right in the middle. I'm not sure if the pointer works, but you can see the backbone right in the middle. And over there, the lungs become correct. So the lungs become kind of black on the right bottom slide number D. And that's because the fluid has slowly settled off and the heart is not pushing on parts of the lung, which is why we want people who are even awake to actually do the exercise of proning. And proning is one way to open up the lungs because most of the lungs are also in the back of the chest. Next slide, please. So if you look at the anatomy of the lung itself and take some sections and take a look at the anatomy on the actual like a microscope, you can see that actually other things happening, which are blood clots. The pink, dark pink stuff is clotted blood. And unfortunately, that also happens in patients. And it's a sad thing because a lot of people, you don't know that they are blood clots and you can't find out unless you do blood tests and even do CT scans. But some of them are so sick, you can't even get them to the places where you need to do a CT scan. Next slide, please. So suppose somebody had ARDS, which is what we talked about. So this is a technical slide, but unfortunately, only half of them get back to work after ARDS. Many people can't walk 6 minutes properly at the end of a year, but over a year or so, many people improve. About half of them may have mental health issues or memory issues, and they may have depression and muscle weakness. And these things are known for a long time. With COVID, we will be seeing similar problems. And unfortunately, that's kind of where we have to manage in the post-COVID scenario. The rehabilitation is very important because most patients who have COVID can get back to a completely functional life with support. I've personally seen patients with very scarred lungs who got out of ventilator, ended up with needing support with oxygen, but over the time of a few weeks, their oxygen requirement has come down as their general body strength has improved. See, normally you might not have realized, but as you're listening to me, you've been shifting in your seat, you've been moving, you've been taking deep breaths, lifting your hand. All of that are keeping your muscles moving and in shape and in tone. However, somebody in a ventilator in an ICU on a ventilator is going to not move at all because they're going to get sedated, paralyzed if needed, and they're completely unconscious. So the muscles get weak and deconditioned. Next slide, please. So one of the things that rehabilitation does is you can, like we are doing right now, for example, I talked to you about the anatomy of the lung, the physiology, what happens in lung disease. How do you do breathing training? How do you do special techniques of breathing? And Dr. Kennedy's team is extremely well qualified to teach you these things where they'll teach you how to take a deep breath, hold it, and do something called pursed lip breathing, where you're taking a deep breath and you're blowing out against closed lips to kind of give back pressure to have the lungs open. So one of the things to know is if you imagine the lung is a balloon and you start blowing it open, to keep the balloon open, you need to put some air and little pressure. And that's the kind of pressure that some ventilators do and that you also do when you're short of breath and when you kind of close your lips, you're giving a little back pressure to help the lungs. So just briefly, the other things we touch on when you do rehabilitation is to talk about oxygen therapy. We talk about symptom management. I also talk about something called energy conservation. If you need oxygen and you have difficulty breathing, you want to get from point A, say your bedroom, to your kitchen, you need to take it in steps. You take 4 steps, take a pause, let your lung recover, let your body recover, and then you kind of move from there. The next thing to look at is 2 things which save your lungs, which is avoid dust, stop smoking, avoid hookah, avoid anything that can irritate your lungs. So if you kind of move to the next slide, please. So there's evidence, this is from an article that I had written for the chest, like it's a blog that we write. We looked at it and it looks like pulmonary rehabilitation actually saves lives. In fact, you can even do lung rehabilitation remotely. And I'm sure Dr. Kennedy's team does that. We do it from a hospital. We do lung rehabilitation for patients wherever they're located, where we teach them how to do exercises. And in the pandemic world, pretty much everything is remote except eating food. We order food, but we can't still send food across. And I know you guys have a pretty good lunch shared up there. enjoying your, I forget the brand name, but the dates from the Russell Khema area, I think they're very good is what I've heard. So I think the reason I bring it up is people lose their taste of sense of smell and taste in COVID. Sometimes it comes back, sometimes it doesn't. And there's a little joke that's running around on WhatsApp, where somebody's complaining to the people in the house saying, you know what, I can't taste the food, what's going on? Turns out the cook forgot to put the salt in the diets, and everyone thought they got COVID, but it was just that there wasn't the salt put in the diet. So, the thing is that sometimes we need to figure out that not everything is COVID, but post-COVID, people do have problems sometimes. And some of the challenges are to try to both improve the quality of life by involving the mental health issues and taking care of counseling, talking to people about it, the physical issues where you need to get back into rehabilitation and strengthen things up, and of course, the medical issues where you need to get oxygen or need medications, watch for infection. And in India, we have the problem of the fungal infection going on now. Next slide, please. And very quickly, there is data I've borrowed from some medical resources, studies which have shown that exercise training actually decreases the shortness of breath. Oxygen does it, inhalers do it, but if you actually exercise, it improves the feeling of shortness of breath. And that's a very important thing because most people, even without fixing the disease, can feel less short of breath. And if you look at the next slide, it also shows that there are many situations where they've done large studies where your exercise capacity, your fatigue, your emotional function, all of those get better. If you look, everything on the right side of the slide says that things are getting better. All of these actually improve with lung function improvement because of pulmonary rehabilitation. Next slide, please. I'm almost towards the end of the talk, and this is a tweet that I put out last year and this year too, which reminds you that despite COVID, despite vaccines, despite treatments, you still have to wash your hands, avoid touching your face, wear a mask at this point. Some places are opening up, but at this point, given the amount of disease that is out there, obviously, wear a mask. And if you can, participate in research trials, stay in touch with your friends and family. I don't like the term social distancing. I call it physical distancing. Emotionally, stay completely connected to your friends and make sure that you do that. Next slide, please. So in all of this, it is critical to care. And I'm a critical care doctor, but let's not forget, it is critical that you care for your own health, the health of your family and your friends. And rehabilitation is all about getting back into what you were doing before, using all the different techniques that you have. So far, we have touched about the pathology of the disease. We talked about the anatomy of the lung, the physiology of the lung. We talked about what happens in COVID, where you get scarring of the lung, you can get blood clots, and the treatment for these will lead to a situation where you need to go through specific ways of taking care of these problems. Like you might need oxygen from outside. You might need to do breathing exercises. You might need to rebuild your muscles that got weak because a lot of the chest, the muscles get weak, you get breathing gets tough. Next slide, please. It's also very important to remember to first do no harm. It's a picture of Hippocrates, the patron god for doctors, because there's many treatments running around, but you have to be very careful not to overdo things that you don't need. So it's very important to not unnecessarily take medicines that you don't require. It's also important to control your secondary health issues, including things like diabetes, to keep the sugar under absolute control. Make sure that you don't have any heart disease. And in the pandemic, I've picked up several patients who didn't know they're diabetic, who didn't know they had heart disease, who didn't know they had lung cancer. So these things have been all picked up. Next slide, please. So if you were to take the secrets of a COVID warrior, though this slide clearly didn't come out, it's always a tussle between Macintosh and PowerPoint. Mac gets us, you make these beautiful slides on Mac, but it doesn't show up in PowerPoint. So anyway, this was supposed to be a nice emoji of a samurai warrior fighting COVID. And next slide, please. What I would say that, there are some things you can control, some things you can't control, which is, some things we all know about. And the things you can control, which is shown in the next slide, are things you can actually do. And that is tobacco use, your allergies, your asthma, your COPD, tuberculosis, sleep apnea, COVID. These are things you can control. Next slide, please. And things you can't control, which include things like secondhand smoke, your allergies that you're exposed to, dust, sleep apnea, sometimes you can't control, infections like fungal infections. So it's important to recognize there's actually a lot of things in your hands. So don't get desperate. COVID is a big challenge for humanity. It is a big problem for people who have had COVID. There is a lot of loss going around. People have lost their loved ones. But despite all that, the human species is able to go through these things with success. We have conquered more difficult things, and in your own lives, you have conquered more difficult things. There is a pathway. And if you look at this, I like to tell you that this is not another planet. Some people say it's Neptune. No, it isn't. It's Earth. And if you just think about it, sometimes you have to look at things a little differently. You have to look at your world differently after COVID sometimes. It's important for you to recognize that there are things you may have to do differently, which may mean it takes a little more time, but ultimately remember the purpose of your life and living is to kind of help everybody and have a reasonably happy life. And you can do that even after COVID. So I'm going to close off by saying that it's important that, next slide, please. What the mind does not know, the eye does not see, and the ear does not hear. So it's important that the facts that you learned today are hopefully some of it is new, and it's kind of useful for you to think about and utilize in the next steps if you've had COVID. Next slide, please. I'm going to close out by a little pun that I wrote, which says, exercise your right to breathe. Each step a marathon, every breath critical to carry on. Can rehab relieve is a questioned hand. And when the evidence says so, let's stop saying no. There's good data suggesting that lung rehabilitation works. And it's very important that you never stop learning because life never stops teaching. So I'm going to stop there. And there's no questions coming in the chat already. I'm going to let Dr. Kennedy direct that. And again, thank you so much for this opportunity to talk to you from Hyderabad, India. And I'm glad to be able to be of any help that you might require. Thank you again for this opportunity.
That was absolutely brilliant. Absolutely brilliant. The essence of a brilliant speaker is to make a complex subject simple. And that is exactly what Dr. Sai Praveen has done. He has made a complex subject so simple that all of us have been able to understand it. And I recall in somewhere along in his address, he said, if you have learned even a little, it's a good thing. And I have certainly learned many things. For example, I did know that the lungs had the capacity well, in terms of measurement, it was equivalent in capacity to a tennis court. But what I did not know was that when you have lung insufficiency, this shrinks to the size of a table tennis court. Now, that is something I have just learned, and I'm grateful for that. I also learned that when you take a deep breath, you actually double your existing capacity. That's what the air you've gotten. Well, I'm an exercise specialist, but you learn things from these lung functional, you learn things from these chest care physicians who, of course, are experts in their area. On a personal note, I had the good fortune of meeting Dr. Sai Praveen in an emergency situation when my wife had difficulty breathing. And I recall that of the many names of individuals that she knew, she said, let's go to Dr. Sai Praveen. I'd like to meet with him. And I had the great pleasure of meeting Dr. Sai Praveen. And it was, as he rightly says, it was life-changing. She's able to breathe much better, and we are so grateful. In fact, when we needed someone for today's talk, I called my wife back and I said, Docky, you remember we went to this physician who helped us so much. I recall his name was Dr. Praveen, and she said, what for? I said, well, I'd love him to come on our program. It would be an absolute pleasure. And Dr. Praveen, thank you so much for your talk today. Thank you so much. Now, one of the emphasis that Dr. Praveen gave was that exercise doubles your capacity in terms of, well, it improves breathing. He also said smoking is bad, and these are good things. It makes people like me who are in the area of lifestyle medicine feel so grateful to my colleagues in medicine who are so supportive in their approach. Thank you so much once more, Dr. Praveen. Well, taking a line from Dr. Praveen, I'm now going to introduce our second speaker. Our second speaker is the answer to many of the problems that Dr. Praveen presented, and even he offered the remedy that exercise is a good consideration. Now here, ladies and gentlemen, we have an outstanding professional in the area of exercise. We have Coach Lalit Adhikari, who, as I recall, was in the Indian Navy for many years, and then he joined me in Tata Steel, where he went on to become Mr. India. And he went on to become Mr. India 7 times. He is a bodybuilding exponent. Well, then he went on to train Mr. Asia, which means that he trained his colleagues and his wards to become international sportsperson like he himself was. And as a participant and as a coach, he has traveled along with the Indian team to Singapore, Manila, Sri Lanka, Seoul, China. Well, he's been around the world, including Los Angeles, California, Belgium, the United States, etc., etc., etc. And I have the absolute honor to know Coach Adhikari. I recall when Coach Adhikari joined Apollo Hospitals, he introduced exercise and gym to our medical doctors. He said, if you want our doctors to prescribe exercise, we must teach our doctors how to exercise. And Apollo was one of the few hospitals in the country, and perhaps the first, that opened its own gym for doctors. And that was credit to Dr. Adhikari. I'm credit to Coach Adhikari. Well, Coach Adhikari is also academically certified. He has done his postgraduate diploma in preventive medicine and in wellness management. Now, along with Coach Adhikari, we have an expert yoga professional. We have Namita, who is a Yoga Ratna and a Yogacharya, studying out of India. And between the two of them, we will talk about several exercises that can help us to improve our lung capacity. Coach, the floor is yours.
Thank you for introducing me to the audience. In fact, I was really delighted to listen Dr. Sai Praveen. In fact, I have also learned many things from him, as you said, the medical aspect of the breathing problems. I will be more than happy to share my feelings and my expertise to the audience. First of all, I'm very, very grateful to the esteemed previous speaker for having explained so nicely about the respiratory disorders. Now, I will be utilizing this opportunity to propose 3 types of breathing techniques to improve the lung function in post-COVID clients with breathing difficulties. These are yogic breathing techniques, Western breathing exercises, and medically recommended breathing techniques. So as I told you, I will be showing 3 types of breathings. There is the yogic breathing, Western breathing, and medically recommended breathing techniques. Now, when I come to the yogic breathing, next slide, yeah. Now, yogic breathing techniques, first of all, let me just explain all of you. The yogic breathing techniques, these are thousands of years old and benefit not only the body, that is the heart, lungs, circulatory system, etc., but also the brain, the mind, and the emotions. Yogic breathing is used to relax the body, manage stress and tension, and also helps in meditation. Now, in this yogic technique, I will be explaining 3 types of pranayams, that is Bhastika pranayam, Kapalbhati pranayam, and Anulom Vilom pranayam. Now let us take the Bhastika pranayam. Bhastika pranayam, or you can say force breathing or bellow breathing. In this, what we have to do is sit in any comfortable position place your hands on your knees and breathe in through nose and breathe out also through nose. When you breathe in, expand your chest and push your belly out. And when you breathe out, contract your chest and push your belly in. This is a forceful breathing technique method. This causes the diaphragm to move up and down and increase the oxygen intake. Also increase the exhalation of air from the lungs. This, you may do it for, in the beginning, 10 times. If you are comfortable, you can increase the repetition as you wish, but be comfortable at all times. Do not force yourself to do more. Now, the next one is the Kapalbhati Pranayam. This Kapalbhati Pranayam is a belly breathing. This is a peculiar type of breathing. The inhalation is automatic. You don't have to put any effort on this because without inhalation, we can't survive. So air goes automatically. Inhalation is automatic and exhalation is quick and forceful. You will see it in the video. When you exhale, what you have to do is exhale through nose and inhale also through nose. When you exhale, push your tummy in with force. This pranayama, this Kapalbhati pranayama has got immense benefits. And then, so far as the timing or repetitions are concerned, again, you can start with 10 repetitions in the beginning. If you're comfortable, go on increasing the repetitions, 15, 20, or you may go to even 100 also. But no force and no tension at all. Be comfortable at all times while doing these breathing exercises, especially yogic breathing exercises. And the third one is the Anulom Vilom Pranayam, which is also known as alternate nostril breathing. This is also known as king of all pranayams. It's a very simple pranayam, but the benefits are immense. You can't even think. There's so many benefits in this Anulom Vilom Pranayam. Your lungs, your heart, especially the heart patients, they practice for a long time, and it is proved medically also. And so far as the practical aspect is concerned, you will see it in the video. You breathe in through one nostril. That is, first close your right nostril and breathe in through the left, start. And then close your right, breathe in through left, close your left and breathe in, breathe out through right. So it's an alternate nostril breathing, in, out, in, out, in, out. Continue this for, so far as time is concerned, you can start with 5 minutes first, or so far as the repetitions are concerned, you can start with 20 repetitions and thereafter gradually move on as you are comfortable. The next slide, please. Now, this is Western breathing techniques. These are very simple, but also very beneficial. In the Western breathing technique, I will explain two specific breathing techniques. One is the diaphragmatic deep breathing, and the other one is pursed lips breathing. This was also shown by Dr. Sai Praveen, but you will see it in a video very clearly and you can follow easily. In the diaphragmatic breathing, you inhale through nose and then raise your hands up, so that as a result, you expand your chest, push your belly out so that the diaphragm is pushed down. And then when you breathe out through mouth as you're comfortably breathing out. And then this breathing also continue for 10 to 15 repetitions. You can do it once or twice daily. And this breathing is done preferably in standing position. Breathe out forcefully through mouth. Breathe in through nose and breathe out through mouth. When you breathe out, constrict your chest. Bring your hands down. So each breathing, you raise your hands up, and each breathe out, you lower your hands down. This you can do it for 10 times. And later on, you can do it for 15, 20 times. This breathing, normally you will see many sports persons, they practice when they get fatigue. The runners, the long distance runners, the short distance runners, any sportsman, the tennis players, the badminton players, when they get fatigue or breathless, they do deep breathing exercise. And in about 10 deep breathing repetitions, 10 repetitions, they become absolutely comfortable. And then when it comes to the pursed lips breathing, it is a process, inhalation through nose and exhalation through mouth. Inhalation will only become deep when you exhale the breath deep. Now in the exhalation, there's a typical type of exhalation. You got to close your lips and as if you're blowing a balloon or blowing a whistling noise. You can take out a whistling noise so that the exhalation becomes smooth, slow, and long. So inhalation through nose and exhalation through mouth. This also you can practice 5 to 10 times and maybe once or twice daily. Next slide, please. Now this is the prone breathing or postural breathing. This is COVID-related breathing, and doctors normally advise to do this breathing when you are having any breathing problems or post-COVID breathing disorders. So this is a very practical, which I have practiced on one of my colleague's wife, who is staying just beside my house. She is just recovered from the COVID problem and now in house quarantine, but she's having a lot of breathing problems. She cannot breathe properly. She's having difficulty in breathing. I have told her husband that this is the process you can practice and try this for a day or two and then let me know. Believe me, this has worked like a miracle. The lady has recovered. Now she is walking out and she's going for evening walk, morning walk. And now she says that I will start cycling also. So it's a great exercise, prone breathing exercise. In this, simply you got to lie down on a mat, face down, and put one pillow under the top of your chest and the other pillow under your hips, that is the pelvic region, and then breathe normally. This I have exhibited in the video. You will see it soon after this, my talk is over. Continue this breathing for at least 15 to 20 minutes. If required, you can do more. But so far as your comfortable is concerned, you can do it for 15, 20 minutes easily. And then take out the pillows and simply lie down onto any of your side, either onto the right side or left side or both sides. You can do right and thereafter you can turn to the left. Simply lie down on your side and breathe normally. This gives you a lot of relief and some people also find comfortable in a prone sitting position. Sit on a bed or on a sofa with back support. This also I have indicated in my video. And breathe in comfortably. The time is yours. You can take 15 minutes, 20 minutes, or whatever time you are comfortable with. Now, this is so far as my presentation is concerned. I think we have completed the presentation. Now, do's and don'ts. Especially in the breathing exercises, also the yogic breathing exercises, use loose clothing. Wear something very comfortable, loose. Posture, maintenance of the posture is very, very important while doing the breathing exercises. Freshen up before doing exercises. That is your morning routine. And you can drink a glass of water before exercise if you wish. But in between, if you feel too much of thirsty, do not drink too much of water. You can take 1 or 2 sips or maybe half glass of water. Now, when it comes to the don'ts, avoid eating before exercise. That is breathing exercise. Do not do this exercise, breathing exercise, soon after the food. At least there should be 3 to 4 hours gap. As I've already told you, avoid too much of drinking water during the exercise. And clothing I have already mentioned. Straining yourself. See, if someone says, do this 50 times, you may be getting strained or you may not be able to do it. You're feeling difficulty, but do not strain yourself. If you're comfortable with 10, do 10. If you're comfortable with 20, do it 20. And thereafter, gradually, you can increase the repetition. I'll be more than happy if any question is there to ask about this topic. In post-COVID respiratory disorder, certain breathing techniques help in increasing oxygen level in our body. Yogic breathing technique, Bhastrika Pranayam. Sit in any comfortable position. Place your hands on your knees, eyes closed. Breathe in through nose and breathe out through nose with force. Continue this breathing for at least 2 to 3 minutes. Thereafter, increase the time gradually. Kapalbhati Pranayam. Sit in any comfortable position. Place your hands on your knees, eyes closed. In this breathing, your inhalation is slow and normal, and exhalation is quick and forceful. When you exhale, push your belly in. Continue this breathing at least for 20 times. Thereafter, increase repetition gradually. Anulom Vilom Pranayam, alternate nostril breathing. Sit in any comfortable position. Place your hands on your knees, eyes closed. Place your right hand thumb on your right nostril and close. Breathe in through the left nostril. Close your left nostril with your right finger and breathe out through your right nostril. And again, breathe in through the right nostril and breathe out through the left nostril. Continue this breathing for at least 5 minutes. Thereafter, increase time as per your capacity.
Western breathing technique. This breathing can be done in a standing or sitting position. Breathe in through nose, stretch your arms to expand your chest and push your belly out. This lowers your diaphragm and increases your lung space. And breathe out forcefully through the mouth and pull your belly in while your lung space is reduced. Continue this breathing 10 to 15 times and gradually increase repetition as per your capacity. Pursed lips breathing. This breathing can be done in a standing or sitting position. Breathe in through nose, deep, and breathe out through mouth slowly and completely. While breathing out, exhale the air with a whistling sound. COVID-related breathing, prone breathing. This is done in a lying position. Lie down on your belly on a mat. Keep a pillow under your chest and pelvic region. This increases your lung space. Breathe normally at least for 15 to 20 minutes. Postural breathing. Lie down on a mat on your right side. Breathe normally 15 to 20 minutes. Do similarly towards your left side. Subsequently, continue this breathing pattern in a comfortable position for 15 to 20 minutes, either on a bed or a chair.
Thank you very much, Coach. Thank you so much. Thank
My
you.
pleasure, sir. My pleasure.
And then thank you and Namita for that excellent video which you showed us. Thank you so much.
Thank you,
That was fabulous. Coach Adhikari has been a teacher in the area of exercise for 2 or 3 decades. Not only does he have a great many national and international sportsmen to his credit, but as you've heard him mention, his neighbor next door was supported by him with breathing techniques. Thank you so much. Thank you so much, Coach. And now I leave the floor open to Dr. Wilku to ask questions or to make available the questions that have been asked. Dr. Wilku has the unique qualification, if I may present it like that, of being a medical professional and a certified health professional. Not only is he a physician, but he is also certified by the American Council of Lifestyle Medicine as a health professional. Dr. Wilco heads the operations of Arabian Wellness over here in Russell Khaimah. He deals with 10,000 or more patients, employees every year. But I leave the floor to Dr. Wilco to ask a few questions. Yes, sir.
Thank you, sir. First of all, I will thank Dr. Sai Praveen for a wonderful presentation, putting the things very easy and in a layman's term so that everyone can understand the things. Even the coach has given a very good presentation for video, the exercise breathing techniques, the yogic, the Western, and the most popular now, the prone breathing and postural breathing. So, am I audible clearly?
Yes.
Yes, sir.
Okay,
I can
fine.
hear you.
Okay, fine. So there are a lot of confusions regarding, you can see globally, we see there are oxygen depression, the SpO2 is going down, the breathing complaints are there, cough is there, pneumonia develops. Now a new thing has been, it's not new, but it's popularized now, the black fungus, the mucopsychosis. So, okay, those things are there. And like rightly, like Dr. Sai Praveen has mentioned, there are a lot of ways and consultations and health advocacies being given. Uh, don't rely or don't overdo things until your doctor says to do it. Because see, you are not helping out using the information in the site, but you are overloading yourself. Maybe that particular aspect of lifestyle or medicine or whatever it is, so may impact your health. So I would rather suggest everyone, whatever Dr. Sai Praveen and Coach Adhikari has mentioned, these are the specific things which can be done very easily, understood easily, and will help you out. Definitely, or any medical issues, you should contact your physician, treating doctor who is treating you. And general questions we receive, generally we receive a lot of questions. Now I have been seeing so questions, and Dr. Sai has replied to few of them. So I will skip those, but I will definitely ask one question. Doc, there is generally confusion about that SpO2 level, the oxygen saturation level, is connected to breathlessness. So, is it true? Whether breathing difficulty is really connected to the oxygen saturation level, or it may be different? Dr. Sai, please.
Thank you, Dr. Viklu, and thank you for Professor Kennedy for telling us about the qualifications of the Vilku. So I'm sure once we are done, your audience can get back to you and get more details. But see, honestly, breathing difficulty can be from anything. It's all in the head. In other words, the sensation of breathing difficulty is a sensation. And it can arise from anything from the brain all the way to the periphery. Meaning, if somebody was pushing your chest, you can feel short of breath. If somebody was holding your mouth, you can feel short of breath. If your oxygen was low, you can feel short of breath. So anything that is not even just low oxygen, anything that impairs the function of the entire breathing system can affect it. Your lungs have multiple receptors. They're called J receptors. They are stretch receptors also, where anything that is impacting the lungs can send a signal to the brain, which it interprets as not getting enough air. So one of the causes of not feeling like you're getting enough air or short of breath or dyspnea is low oxygen. And the pulse oximeter picks up that one specific cause of breathing difficulty. Now, a pulse oximeter is a device like anything else, and it's very, very prone to error. So it's important that you get a good pulse oximeter, check it on more than one finger, check it on more than one person. Too much light will affect how it works. Nail polish will affect it. So it's important that you get a correct reading. I also like to do something called a walk test. I make them walk and see what the oxygen level is to see if it is decreasing or increasing. So these are all simple things you can do to check on that. So SpO2 being low, and being low is really 94 and below is kind of low, but 90 or 88 and below is where you need to give outside oxygen. And you can test it yourself. Your pulse oximeter even now, just sit on it, take 5 deep breaths and wait about 2 minutes. Let the extra oxygen you breathe go through your system, through your lungs, end up on your fingertip, you'll see your oxygen level go up. So it's pretty easy to know that oxygen levels can go up pretty easily, especially with proning also, as Coach mentioned beautifully. An amazing video by Coach and his team. So I think what we need to recognize is that SpO2, yes, can cause breathing difficulty if low, but it's not the only cause of breathing difficulty.
Sure. Well, thanks, Doc. Again, there is one connected question, I think. Mr. Soheb is asking, he was suffering from COVID last year in October. And during and post-COVID, he didn't have any problem, but he always feel breathlessness. Now this breathlessness is aggravated. So is it a physical ailment or a psychological ailment? You have already explained, but I think you should put on that also.
Sure. So I've answered all the questions in the chat individually to the speakers. I wasn't sure how many of them wanted to reveal their histories and all that. But in general, if you were to look at somebody who has had COVID, now October 2020 is now another decade ago, almost like 7 months ago. You can forget when that was. So 7 months, you're still feeling symptoms. It may be a new issue. It may be related to some element of lung scarring. It may also be related to anything which we talked about earlier, like a low hemoglobin can cause it. You can have heart issues that can cause it. You can also have situations of wheezing that can cause it. If there is scarring in the lung, it can cause it. Psychological issues can cause it. Low thyroid, high thyroid can make it happen. So you should definitely sit down, meet one of the doctors at RAK and chat with them. I know I looked through your list of doctors. You have some really well-trained professionals, consultants in your hospital. Meet one of them and have them examine you and see Is this a medical issue related to wheezing, related to low hemoglobin, something to do with the heart? Is there scarring in the lung? So they can look at all of that and then make a decision as to what the next step is. Of course, if it is related to anxiety and stress and tension, you can meet counselors also to kind of clarify that. But both can happen. My recommendation always is to rule out a medical cause, which is quickly treatable, while simultaneously looking at other causes.
Yeah, thank you. There are always a confusion that what exercise, because you can see in the internet, there are a lot of exercise patterns are being given. So coach, I would like to give your reference. You have beautifully explained the yogic breathing techniques, the Western breathing techniques, and especially the prone breathing. Prone breathing is an old technique we used to do in ICUs when there is a breathing distress. But now it is being popularized because of a lot of consensus in India and other countries also. So what do you recommend? Which one is the best exercise to practice on a daily basis, coach?
It's a very good question you have asked. Which exercise or which breathing exercise should be done, on a daily basis? I would recommend to do the yogic breathing comfortably, as I told you, the Bhastrika. Bhastrika is not only for increasing the lung capacity or whatever, it also cleans the nose, the nostrils. Unless you have a clean nostril, you can't breathe properly. So Bhastrika helps in cleaning the nostrils. There are different type of Bhastrikas. You don't have to go deep into the subject. Otherwise, you'll get confused. Simple is breathe in forcefully and breathe out forcefully through nose. Automatically, the nostril gets cleaned. Say about first 10 repetitions, it is a cleaning process. And thereafter, the actual breathing takes place. It goes into the diaphragm and then so on. So far as the yogic techniques are concerned, Bhastrika is a very good breathing exercise. Kapalbhati needs to be done under an expert's guidance. Because if you do a wrong breathing, especially the Kapalbhati, you will get no advantage at all. So it is better to practice under a guidance, under an expert's guidance, and then practice. Do again as per your body's comfortable position. And then when it comes to the Anulom Vilom, it's a very simple breathing technique which everyone can do. And this can be done anytime. There is no time for this. Even after food also you can do it, but not immediately, maybe after half an hour gap or so. So people say that this is a king of breathings. Even yogic experts, they say it is a king of breathing. The alternate nostril breathing is a very comfortable and easiest method of breathing. And when it comes to Western technique, you may do simple breathe in, breathe out. But definitely during these days, the COVID pandemic, you must every day try to do at least the prone breathing and the postural breathing.
Yeah, thank you, coach, for a wonderful explanation. I will just add one thing, like for the Kapalbhati you mentioned. So I would rather suggest all the people, those who are doing Kapalbhati, please take clearance from your doctor. Because if you have any hidden complication or disease in the stomach area, abdominal area, doing Kapalbhati may aggravate that. So first you should be knowing about it, take a clearance from your medical professional, then do Kapalbhati. Kapalbhati is very good, but very active form of exercise, yogic exercise. Okay, one more question which is very common nowadays. Dr. Sai and coach, I will both of you request to answer this for your aspects. Dr. Sai, can you just give in a line that what is the best way to keep your lungs healthy?
Breathe pure air with no pollutants, without tobacco exposure and no microorganisms, and keep doing that all your life. That is the one-line answer. But really what you need to do is try and avoid damaging your lungs as much as possible. What coach has said about breathing exercises, deep breathing, keeping the passages clean, all that makes a difference. In the COVID era, obviously try to wear a mask to protect yourself, but also make sure that, I'm worried about one thing which no one's talked about. What are the masks doing to our breathing? Because some of these masks
I was going to ask you. Yeah. please.
Right. You have to be cautious
Please.
about the kind of mask you're using, and as much as possible, be in a place where you don't need a mask. So, you're just in
Yeah.
a own environment and breathe, clean air. So that's something very important. There is good data showing that air pollution kills. It's been known for decades. People get more heart attacks, they end up in more cancers, they end up with more lung diseases. Children actually have been known to improve their lung capacity by moving from a high pollution city to a low pollution city. They've done those studies. So I think air pollution is something, of course, global warming and air pollution is something we need to all as a community and as a planet need to fix. So if you were to really fix one thing long term to help our breathing, it's avoid air pollution and stop tobacco use. Those would be the biggest two things you can do beyond anything else, actually.
Yeah, thank you. Coach, what would you suggest? You have already explained just before this
Yeah.
question.
As an exercise specialist, I would advise people to do regular exercise. It could be in home, it could be the outdoor activities, but so far as outdoor activities are concerned, it should be a very open space and no closed doors or gatherings. Walking is a very good exercise. Walk freely and do the breathing exercises whenever you feel like. And of course, exercise is the only solution for that.
Yeah, thank you. Professor, I would rather request you to put up one note because you have been a lifestyle specialist and exercise specialist too. So, we used to do a lung capacity test. I would request you to tell everyone what exactly is the lung exercise test, lung capacity test. How should you test yourself, your lung capacity? And anyhow, Dr. Sai and coach has already explained how to improve it. That is the improvement is a part, but how to test your lung capacity. Professor, I would like you to explain that.
Very kind, Dr. Vilku, very kind, very kind. We have a series of very simple tests that enable us to evaluate our health or our fitness or our psychological well-being, etc. They are simple, very simple tests. Now, as far as lung capacity is concerned, we simply ask each individual to sit upright with the chest fully expanded, as Dr. Sai and Coach Adhikari have explained, to sit with the chest completely, with the chest expanded, sit upright at 90 degrees, and then take a deep breath. Okay, please watch me. You just take a deep breath through your nose. And then I ask you to hold your breath. Of course, this comes with a rider that in case you are asthmatic, in case you have hypertension, in case there are any reasons why you should not do this test as advised by a doctor, please don't do it. But in order for us, lifestyle specialists or fitness professionals, and I'm sure even medical professionals, while there are instruments that can help you to gauge your lung capacity, we simply ask you to take a deep breath, as I explained, and to hold your breath. Now, your cardiologist will be delighted if you can hold your breath for 45 seconds. Your cardiologist will be delighted. He will say, yes, you have sufficient oxygenation, and I'm sure he will correlate it with hemoglobin and other such things. Now, from a fitness professional's point of view, we usually ask that this should be 1 minute or 60 seconds. So whenever we do tests for the lay public, we ask them, can they take a deep breath, hold your breath, and we check if they can do it for a minute. If they can do it for a minute, we are delighted they have sufficient lung capacity. Then we simply add to their stamina building, which could be walking, jogging, running, deep breathing, and other such things. I hope my answer has helped you in some way, Dr. Vilku. But before you take me off the air, I want to comment on just one statement made by Dr. Sai, which has absolutely touched my soul in a manner of speaking. I have two beautiful grandchildren. I have three grandchildren, but two from my daughter and one from my son. and my two grandchildren who were with my daughter were living in one of the largest cities in the world, internationally so, one of the largest cities in the world, and they were constantly having problems in terms of running nose. There were discomfort, low fever, and things like that. And for the love of me, we couldn't understand what the problem was. And then my daughter hit upon a solution, and she said, look, in spite of all these air purifiers and air conditioners and whatever it is, the pollution level in this city is frightening. And therefore, I am going to take my children. If my husband would like to come, he is more than welcome. And I'm going to live in a less polluted city. The husband, of course, was very happy to join. And they all moved to another smaller town and a beautiful little city in the countryside. And my grandchildren's breathing problems vanished. Exactly like Dr. Sai said they would. They vanished, and they are running around and playing every day. I'm sure if there are no more questions, can I wrap up, Doc W, or do you have more questions?
No, sir. All the questions have been answered. Most of the medical aspects have been answered by Dr. Sai, and there is no more questions.
Thank you, Dr. Wilku. So I will wrap up. Friends, you know, the information that we get on these webinars that we do every week are so valuable. They are so valuable. I have made a note on a piece of paper because that is the generation from which I come, which has all the notes presented by each speaker. I mean, and the information is so valuable that this is not the webinar. Today's webinar and our webinars that went before this are not one-time sessions. I would like you all to log in, and this is not for the reason that I want to exhibit or I want to promote our website that you can see on your screen, but this is, as Dr. Sai has said, that this is e-access. This is valuable to the entire community, valuable to hundreds and thousands of people around the world. So please log on to our website. You will find all the videos recorded over there. This is 1 hour of invaluable information with every single video. And this one on the respiratory disorders and its management is a keeper. You must see this. Please log on to our website. There is a questionnaire that if you fill in, we will give you personalized advice. Watch our videos, which we would like you to do, and we will be so grateful. Thank you so much. I would like to conclude by thanking Dr. Sai for his time. Now, I'll tell you another little story. You know, you're not going to believe this, but Dr. Sai sent in all his information about a half hour before the webinar started. And you can imagine the stress and tension that Dr. Wilku and I and the rest of us were under so much of stress, as a matter of fact, that I called my wife, who is a psychologist, and I said, hey, Docky, now Dr. Sai lives in your city. Can you give him a call? We are desperate. We haven't got his papers. And she said, hang in there, Professor, hang in there. Dr. Sai is a frontline worker. He has got many things to do. He has many lives to deal with. You will get your little paper when the time is right. Just go to sleep, and we'll talk about this tomorrow morning. And lo and behold, when I got up in the morning, Dr. Wilku gave me a call. He said, Dr. Sai has sent his presentation. I said, God bless him. God bless you, Dr. Sai. Thank you so much.
Thank you.
God bless you, Coach Adhikari. Thank you so much.
Thank you.
Dr.
Thank
Wilku.
you. Thank you.
Work expands to fill the time available to do it.
Very,
Thank
very.
you, sir. Thank you. Thank you all.
Very-
Thank you, dear
It's a great
listeners.
moment.
Thank you so much, and good day.